good afternoon, and welcome. Thank you for joining us today for Getting Help for Children and Youth with Mental Health Needs. As Jamie mentioned, you will be receiving an email with a survey, and it'd be great if you could fill those out. And once you fill those out, the certificate of attendance will be available. We also want to note that these workshops are geared towards parents and family members. Professionals are welcome to attend, but our target population is parents. People joining from other states can also join us, but please note that some content is based on Minnesota state statutes, which may vary in other places. So please check your local statutes if you live out of Minnesota. We should have some time to address your questions at the end of the time today. So please feel free to put those in the question and answer box if questions come to mind. Next slide. Just a little bit about Pacer Center before we introduce ourselves. Pacer's a source of information, training, and support for families of children with disabilities. Our services help families and youth navigate special education and other complex systems, discover assisted technology solutions, and access bullying prevention resources. We're the only organization in Minnesota that provides support for families of children and young adults with any disability from birth to age 26. Next slide. My name is Karen Malka, and I'll be presenting today with my coworker, Jeannie. I am a parent advocate here at Pacer, and I am also the coordinator of the Children's Mental Health and EBD project. I have two daughters of my own who both, they're young adults now, but they both have disabilities, including mental health needs. Jeannie, I'll have you introduce yourself.
Hey everybody, my name is Jeannie, as Karen mentioned. I work alongside Karen in the Pacer Children's Mental Health Department, so we are partners in crime. I do have two kids also that are now young adults that were on IEPs when they were in school, as many Pacer advocates are, parents of kids with disabilities. Go ahead, Jamie, next slide.
Next slide. We put this workshop together because we know firsthand as parents how challenging it can be to navigate home, school, and community services for children and youth with mental health needs. Those challenges have only intensified as the demand for mental health services has continued to dramatically increase across the country. It can be challenging to know where to begin to support your child or teen when new or persistent mental health needs impact their day-to-day life. Whether you already have your child on a waiting list for services or are just beginning to explore treatment options, we will discuss some steps you can take while you wait. Today, we will cover working with your pediatrician and insurance, treatment options, county and crisis services, and school resources. Next slide. If you haven't already done so, one of the first things we recommend is to consider scheduling an appointment with your child's primary pediatrician. We encourage you to bring a list of the concerns and questions you want to discuss. You may want to ask them if it would be appropriate to rule out any underlying medical conditions that could be contributing to your concerns. You can discuss care, treatment options, and any referrals you might require to get started. Consider your child from different developmental perspectives. While we typically think of going to a doctor for physical health needs, your pediatrician may have more information than you think about the interplay of these different areas of development. Even if your pediatrician doesn't have the specific information you need, they will likely be able to refer you to someone who does. Let's briefly discuss areas of development to consider as you work toward identifying your concerns. One consideration is physical development. This category includes gross or fine motor skills, coordination, strength, jumping, walking, chewing, ability to write, buttoning clothes, using zippers, tying shoes, turning doorknobs, and level of endurance throughout the school day. Another category to consider is intellectual or cognitive development. This includes a child's ability to process and understand concepts, memory skills, logical reasoning, abstract thinking, problem solving, spatial relationships, and auditory and visual processing. Consider these skills through the lens of age-appropriate expectations. Are they able to follow directions, including multi-step directions, transition to new activities successfully, remember new information? The academic skills category would include math concepts, reading comprehension, decoding words, vocabulary, and reading fluency. From preschool to grade 3, children are typically learning foundational academic skills, letter recognition, how to read, how to apply basic math concepts. You may have heard that kids struggling to learn these foundational skills sometimes begin to falter in 4th grade. This is because 4th grade is typically the age at which students shift from learning to read to reading to learn. Another area of development that may impact a child's mental well-being includes sensory processing skills. These skills involve one's ability to perceive and integrate information they receive from their sensory systems, including taste, smell, hearing, touch, and vision. It includes proprioceptive and interoceptive abilities. Proprioception refers to one's body awareness and how it moves through an external space. Interoception is the ability to perceive the body's signals and internal state, like breathing, hunger, heartbeat, or whether you are warm or cold, etc. Another category is communication or language development. This involves expressive and receptive language skills, listening comprehension, and following directions. Is the child able to communicate their needs to you? Are they able to articulate the sounds and words? Do they have enough age-appropriate vocabulary? If they have difficulty following instructions or expressing big feelings, this can result in disruptive behaviors. Next is social and emotional development. Do they interact with same-age peers? Do they make and keep friends? Are they learning empathy, cooperation, and sharing? Do they understand verbal and nonverbal cues? Are they able to engage in reciprocal conversation, to play back and forth with you or another child? Are they able to navigate various social situations? Are they learning to negotiate, compromise, and problem solve? Are they able to regulate their emotions in an age-appropriate manner? Are they able to make independent decisions, such as what to have for breakfast? When we talk about ruling out underlying medical, mental health, or learning differences, we are looking at factors that might cause or contribute to a child having difficult behaviors or struggling academically. It's important to work with your provider to rule out conditions or disabilities that may cause or contribute to mental health challenges. This may be especially important for youth who have joined your family through foster care or adoption, as you may not have been given a complete health history or information about prenatal exposures to drugs, alcohol, or environmental toxins, such as lead or nutrient deficiencies that can impact cognitive development and behavior. Your provider may discuss medication options to support mental wellness with you. If your child already takes medication, it may be time to review effectiveness and dosages with your doctor. Your provider might also discuss the option of medications that can be used as needed during times of increased stress, anxiety, or dysregulation. Sometimes families prefer to work with a pediatric psychiatrist to manage medications for mental health, but talk with your provider to decide what's best for you and your family. Because there is currently a shortage of pediatric psychiatrists, resulting in long wait lists at times, many pediatricians are now able to help manage certain classes of medications. If you are new to seeking help for your child's emotional behavioral health, your pediatrician may get you started by providing referrals or recommending diagnostic assessments and treatment options. Next slide. Mental health care and treatment. If you are already working with a mental health provider, but feel your child needs more support, connect with them to share your concerns and discuss additional care and treatment options. You can also ask about various therapeutic approaches and the anticipated length of time that may best meet your child's needs. There are many kinds of therapy, and the field is always evolving. It's important to know that children with a similar diagnosis may not all respond the same to a specific approach. Mental health organizations are increasing treatment options to bridge gaps in services. In addition to typical care options such as seeing a mental health therapist weekly, day treatment, or residential programs, some are now including more stabilization and intensive outpatient or in-home services. Be proactive and ask your provider to share all the options available with you. Determining the level of appropriate care is something you should discuss with the primary doctor or therapist and may depend on immediate or ongoing concerns about safety, the intensity of treatment deemed medically necessary, if treatment has been court ordered, and if the child has other needs or disabilities. I'm going to go over some of the options that are included in care when we talk about care and treatment. Intensive outpatient services. This is a program in which a youth attends therapy multiple times per week, but after school or in the evenings. These services can help with treatment planning, caregiver support, in-home family therapy and skill building, school support, and coordination of services. Day treatment programs typically involve outpatient therapy at a program site that consists of therapy and skills training. In some programs, the youth attend the program for half of the day and attend school for the other half. Full-day programs for youth must provide educational services. Inpatient hospitalization for children and youth is intended to be short-term, but provides 24-hour monitoring until the child is stabilized. These hospital stays are typically 24 to 72 hours, but with increases in children and youth coming to the ER for mental health crises, many families are reporting long waits to the ER to secure a bed. I also want to mention between day treatment and day treatment and inpatient, there's partial hospitalization, which is similar to day treatment, but there's more visits with psychiatry and more intensive medication management during that time. But the youth still sleeps at home. So it's inpatient hospitalization. They will stay at the hospital. Hospitalization stays usually aren't, they're more about acute needs and medication management and stabilization rather than therapy and skill building. When a youth needs more intensive support, a residential treatment program may be the best option. The length of stay in residential programs can vary from a few weeks to several months. These facilities provide 24-hour year-round care. They offer various on-site treatment services such as mental health evaluations and assessments, development of individual treatment plans, individual group and family therapy, medication management, and educational services. Utilizing intensive outpatient or in-home therapy options may be well matched for youth who have been through day or residential treatment and are ready to step down care, but still need more support as they transition back to home and school. These may also be options while you wait for an opening in a day treatment or residential program. The wait times for openings and treatment programs vary greatly and may include wait lists lasting weeks to months. Exploring your options allows you to consider alternatives while you wait. Also, often many of these programs have cancellation lists as well that you can get on. When it comes to students with and without disabilities, care and treatment laws outline requirements for providing educational instruction to students during their time in treatment. How education is provided may vary depending on the type of treatment program. In general, the district of residence provides or pays for those educational services. So if the child or youth is attending a full day treatment or residential program, the student will be offered educational instruction during the day at the program site. If they're attending a half-day program, they will usually attend school the other half of the day. The resident district is also responsible for providing transportation to and from the treatment program if it occurs during regular school hours, but they have the right to place reasonable restrictions on this service unless the treatment is court-ordered. For half-day education, the student's district or of enrollment, open enrollment, or charter school can provide those educational services within the district at the student's residence or through a state-approved online learning program if the family of the student under 18 agrees to the form of instruction. If the student is placed in treatment at a location outside of the resident district, the resident district pays tuition to the district providing the education. For students residing in a Department Corrections facility, the Department of Corrections is considered the resident providing district. Residential treatment facilities must contact the student's district of residence within 1 business day to determine if they are a student with a disability and to request the transcript, IEP, and evaluation report. The resident district must send those documents within 2 business days of the request. They must also begin providing educational services within 3 business days after the student enters the facility. The first 4 days of placement can be used to assess the student's educational needs and consider the safety issues. If the student has an IEP, the providing agency must hold an IEP meeting to discuss continuing or modifying special education services in accordance with IEP goals and objectives. There are minimum educational service requirements for treatment centers. These required services include education necessary, including summer school for students not performing at grade level, and 2, school day that is the same length of providing district unless unique needs for an altered day are documented. 3, being included in regular education, least restrictive environment, and Individuals with Disabilities Education Act both apply. And 4, the providing district and resident facility should comply with the Minnesota Pupil Fair Dismissal Act and other relevant state and federal laws. If the student is at the facility for 15 business days or more, an educational progress summary exit report must be provided to the resident district upon discharge. One important exception to be aware of is that applied behavior analysis, or ABA, programs do not fall under the Care and Treatment Act and are not required to provide educational services to youth in their programs. Next slide. Medical insurance. Under most health insurance plans, you need to have a diagnosis for therapy to be considered medically necessary and therefore a covered service. Sometimes we speak with parents who are concerned about a diagnosis becoming a negative label for their child. It can be helpful to think of a diagnosis as a means by which your child can access the services they need with treatment. Children and youth not only have a better chance of recovery, but the risk of future mental health crises may be lessened. If you have questions about coverage and have a policy through your place of work, you can reach out to your company's human resources department to learn more about your plan. If you've purchased insurance in the marketplace, you can review online coverage information or contact your representative for help if the information they've provided doesn't answer your questions. You can also reach out to your insurance provider to help locate medical services and providers covered by your plan in your area. Sometimes insurance companies have staff who can help research options and answer questions about the appeal process if the service you're looking for is not covered, if a provider is outside of your network, or if a provider is not accepting new patients. Many health insurance companies currently also have behavioral health navigators who can help you find out which providers are in network and what's covered. The National Alliance on Mental Illness, or NAMI, offers valuable information on understanding mental health parity in health plans, commonly denied types of mental health care, and how to appeal to your insurance provider and to the state insurance division. Next slide. Another option for seeking mental health support is to call your county's children mental health services. If you have insurance limitations that pose barriers to care, let your county know so that they may help you explore options. If your child has a disability that requires ongoing specialized care, you may want to consider applying for disability determination by the state of Minnesota through a process called SMRT, SMRT, conducted by the State Medical Review Team. A county worker can help you submit a referral to get the process started. Part of that process will include a Min Choices assessment. The assessment helps determine whether an individual with a disability needs services and assists in deciding these types and amount of support that they may be able to utilize. Becoming qualified as disabled by the state may provide greater access to certain healthcare programs or services designed for those with disabilities. This isn't necessarily something that will stay with your child into adulthood. Qualification depends on how the disability impacts the individual. One of the program options that may be available when an individual is qualified is medical assistance, or MA, under TEFRA, the Tax Equity Fiscal Responsibility Act. Even if you have private insurance, MA can help cover therapies or costs your private insurance may not. It also gives you access to waivered services that cover things like personal care assistance and other family support grants. If you need more help navigating this process, you can ask your county case management services. A case manager can help you explore and coordinate therapies, support and services, and assessments such as the Min Choices and SMART process. Minnesota state statutes, which address emergency services, outlined that each county must provide crisis services for children and adults with immediate, direct access to a mental health professional. They must provide 24-hour mobile crisis teams for people with traumatic brain injury, intellectual disabilities, or those who are experiencing a mental health crisis. Call the 988 crisis line or text HOME or AYUDA if Spanish is your preferred language to 741-741 for free crisis and emotional support. This is available 24/7. They will contact you to a trained crisis counselor who can help navigate emotional crises, identify and access resources, and develop an action plan. They can also help you determine when you should call 911 or go to the emergency room. If you have an LGBTQ youth, the Trevor Project offers a 24/7 confidential secure crisis line connecting them to counseling for help. More information can be found on their website at trevorproject.org. If you are uncertain how a crisis line could help support you and your child, take some time to learn more about their resource option and don't be afraid to use it. If you have concerns about calling 911 in a crisis, consider proactively connecting with your local police station to build a relationship with them and learn more about how they respond to mental health calls. If you are not comfortable doing this, you may want to talk with the child's doctor, therapist, or case manager to help you come up with a plan that will work for your family. Next slide. And I'll let Jeannie start from here.
Thanks, Karen. So Minnesota provides several options for school support for children with mental health needs. Two of these options include Children's Therapeutic Supports and Services, also known by the acronym CTSS, and School Linked Mental Health. CTSS is a package of mental health services that include psychotherapy and skills training to help children reach treatment goals. Some schools employ CTSS workers, or they might contract with outside providers to connect a child with these services. So for a student to access CTSS in the school, they do need to have an IEP, and services are then billed through medical assistance. School-linked mental health services are therapeutic services to support student wellness provided by a mental health professional who doesn't work for the school district. If you're interested in exploring an example of school-linked mental health services, you can take a look at the Wilder Foundation website. Under there, there's a school-based mental health menu option. The Wilder Foundation provides access to therapists for several St. Paul public schools. They also provide a therapeutic teaching model supporting classroom mental health in setting for environments. But taking a look at that website will give you kind of an idea of what that school-linked mental health services component can look like. So other options parents and schools might consider include exploring a 504 plan or IEP services to support the student at school. Section 504 is a federal law under the Americans with Disabilities Act designed to protect the rights of individuals with disabilities within programs and activities that receive federal financial assistance. These programs include public school districts, institutions of higher education, and other state and local education agencies. Under 504, a student is determined to have a disability if they have a physical or mental impairment that substantially limits one or more major life activities. The school must conduct an evaluation to determine if the student has a disability as defined under this act prior to developing a 504 plan. Based on documented information from varied sources, the eligibility decision is made based on interpretation of the data by a group of school personnel who are knowledgeable about the child. Every school must have an appointed 504 coordinator. Each school decides for itself how they will evaluate for 504 eligibility. 504 plan evaluations are typically conducted and completed quickly. If the student meets eligibility criteria, they're provided with accommodations to help them access their education. Under 504, schools can but aren't required to offer more than accommodations. They're also not required to monitor progress under 504. Through accommodations, either in a 504 or an IEP, schools can address barriers to learning and participation caused by a disability in a way that enables students to benefit from the school's regular curriculum and activities on the same level as their non-disabled peers. So examples of accommodations to help support a child with emotional, behavioral, or mental health needs might include shortened assignments, use of fidgets, sensory breaks, or a trusted person with whom they can interact when they're feeling anxious at school. If you feel your child may need more than accommodations to successfully access their education, such as direct instruction to build skills, you might consider submitting a written request for special education evaluation to the school. This evaluation looks at how a student's disability or disabilities may be impacting their engagement at school to determine if they qualify for IEP services. The purpose of special education, as stated under the Individuals with Disabilities in Education Act, also known as IDEA or IDEA, is to ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. I think it's always helpful for families who either have a kiddo on an IEP or are looking into it. That definition is really important because sometimes we tend to think of an IEP as an educational program to get a child from one year to the next at school, but the purpose is actually far beyond that, to prepare them for further education, employment, and independent living. So when we're putting together that educational program, that IEP, we're looking at a fairly long lens in planning for that child. The school district must evaluate to determine if a student is eligible for special education under one of 13 different disability categories. Students with mental health needs are often served under other health disabilities category or OHD, autism spectrum disorder, ASD, or emotional behavioral disorders, EBD. Once the school agrees to evaluate and parents sign consent, the IEP team has 30 school days to complete the evaluation process and to determine if the student is eligible for services. The team then has another 30 days to propose the initial IEP. The initial IEP can't be implemented without the consent of parent or guardian. So thinking back to the list we encouraged you to put together earlier in our presentation to make for working with your child's medical team, you can use this list to ensure that the team looking into evaluation for your child includes all of your concerns in the evaluation plan. There isn't a standard evaluation plan for IEP that really customized according to the concerns related to that particular child's ability to access their education. So you want to make sure that they include all areas of concern in that eval plan. Be sure your request is in writing and ask that the school respond in writing. For an IEP evaluation, they should respond with a prior written notice. Schools can also implement positive behavior interventions and supports, often referred to as PBIS, for all students or for an individual student. Positive behavioral interventions and supports are based on the assumption that children may benefit from teaching, modeling, and reinforcing expected behaviors. For students with mental health needs, this might mean building skills related to emotional regulation, communication, self-advocacy, and strategies they can use to ask for help or meet their needs. It's important to ensure that the plan is focused on skill building and support rather than on compliance-based or punitive approaches. A well-written positive behavior support plan should read like a blueprint to help the adults working with the student understand how to best support them to meet their needs and to build skills needed to succeed at school. School social workers, guidance counselors, psychologists, occupational therapists, or speech language pathologists may be utilized to support students who need help building self-advocacy, emotional regulation, or relationship building skills. These specialists can be listed as related service providers on a student's IEP. So if you have a child on an IEP, that's usually the service grid page where you see a grid of the title of the provider, how often they're meeting with your student, where they're meeting with them, and how long they're meeting for each session. Paraprofessional support in the classroom can also be included in an IEP to model for students and help remind them to apply and practice the skills and strategies they're learning. A para can also assist with implementing positive behavior interventions, help keep a child safe, and come alongside them with support before behaviors escalate. Lastly, our state has many school choice options parents can consider. Minnesota allows children to open enroll outside of their residential district if space is available. All charter schools are public schools in Minnesota and are therefore required to provide special education services to their students. Online learning options are also available, and some traditional public schools and charter schools are starting now to provide more online learning options for schooling. For some children with mental health needs, a change in learning environment can be a helpful intervention. Minnesota has mandated educational laws for students with an identified disability. Each state implements the federal laws somewhat differently. States must meet the minimum criteria set forth in federal laws, but they may have additional statutes that go above and beyond what's provided under federal law. The word disability is language used in educational laws specific to special education and Section 504. You have a critical role to play in participating in educational planning for your child. So learning about how these laws relate to the rights of students and responsibilities of schools when it comes to education, supports, and services empowers parent confidence and effectiveness of advocacy. At Pacer, we have many resources and workshops about the special education process to help families understand their rights and how to navigate the process. Check out our website and our Pacer Center YouTube channel for more information. Our YouTube channel, we're adding lots and lots of videos all the time right now. So we have some longer trainings, or if you want shorter snippets of information on a specific topic, you can key in the topic that you're looking for. There's a search bar on the YouTube page for Pacer, and it'll pull up options so you can explore on a particular topic. And of course, you can always reach out to us at Pacer to speak with an advocate if you have questions about special education options. Next slide. So children and youth with mental health needs may struggle to manage their emotions and regulate their behavior when they're distressed. What constitutes a crisis varies. It may be when a child is unable to solve a problem or cope with a stressful situation. They might feel panic, hopelessness, or confusion. These feelings can lead to sudden changes in mood and behavior. It may evolve into a crisis when the safety of the child or others is at risk. When children are in crisis, they are relying on the adults around them to remain calm, make decisions, and to provide support. You and your child, depending on their age, can work together to create a crisis and safety plan. It can be helpful to include any providers, such as the social worker or therapist that may already be working with your child, to generate ideas and strategies. Start by including a statement about how your child looks and acts when calm to create a baseline. List words, gestures, or situations that may increase the likelihood of your child becoming stressed, anxious, or overwhelmed. Describe how your child looks and acts when those behaviors increase in intensity. The crisis plan should be a guide for how to help the child feel validated, safe, and to regulate their emotional state using clear steps that are communicated to and understood by the adults who are regularly with your child. List specific actions that have helped calm behaviors in the past, strategies you feel help prevent a crisis, and how and when to use those strategies. You'll likely want to include both what to do or not do during a crisis, such as identifying known triggers. So, for example, most humans are not capable of effective problem solving or decision making when they're feeling dysregulated. I think we can all relate to that. So, asking a child to make decisions or talk through why they're acting out is likely to escalate their emotions for many kids rather than helping to restore calm. In your crisis plan, include a list of other adults who can help, how they can help, and when they should be contacted. This should include information about when you would call 988 mobile crisis or go to the emergency room or call 911. Be sure to include strategies for working with the child after the crisis is over. Children and youth generally have negative feelings about how they behave when they're in crisis. They might feel ashamed or possibly discouraged, believing that they're failures. The experience is upsetting, unsettling, and in some cases traumatic for everyone involved. Validate your child's feelings and acknowledge that you know this is scary for them. Reassure them that you'll continue to support them and work to help them build skills to cope with their feelings in safe ways. Encourage your child when you see them making efforts to use calming strategies, even when they aren't able to avoid a crisis altogether. And I kind of want to emphasize the point. Our trajectory, our human trajectory of learning and practice isn't linear for any of us. Um, when we're learning something new and practicing something new, sometimes we'll be successful and sometimes we won't. And sometimes we can go for a long time and be successful and then have a setback. It's kind of like, if you don't know how to cook and you're trying to learn how to cook, your first couple of meals might be a disaster, and then you make a few more and they're much better. And then you become a much more competent cook and you're regularly producing high quality meals for your family. and then you burn one and it's a disaster. The same is true for these kinds of ventures for kids. So whether it's your family or school, whoever is taking a look at how your child is doing, I think this is just such an important point to recognize that not all progress is linear, to encourage kids when you know that they're doing their best, they're making their best effort, to not allow discouragement to set in for anyone involved when they have a setback. All right, so if appropriate for your child's developmental capacities, discuss next steps with them, such as following up with their provider or therapist and brainstorm additional strategies for future de-escalation tools and supports. All right, next slide, Jamie. So in summary, I'm just going to run over the tips that we shared for what to do while you wait for care. Work with your primary pediatrician to explore care options. Learn about care and treatment programs. Research what your health insurance covers. Contact your county to learn about crisis service options. Look into the option of case management and disability designation by the state of Minnesota through SMART, Access to MA, and TEFRA. Ask your child's school about mental health resources at school, such as CTSS, School Link Mental Health, or Special Education 504 and IEP options. Create a crisis plan to support your child when distressed until additional care options can be put into place. Many parents, I know myself included, benefit from connecting with other parents for support. You can find groups through social media, children's mental health organizations, or through disability specific organizations. That can be a really great way to connect with other parents. Lots of places offer groups now, online or in person. Receiving support from parents who are experiencing similar circumstances and sharing ideas and resources can be really validating and empowering. I think when we have a kiddo that struggles, sometimes we can feel really isolated, sometimes alienated and misunderstood. Oftentimes, everyone has an opinion about what we should do or shouldn't do, and those opinions are often even contradictory, which makes us feel crazy at times, or at least I'm speaking for myself. That was my experience. So being able to connect with other parents, other families, I think is extremely helpful. And of course, you can always feel free to reach out to us at Pacer Center to be connected with an advocate to talk about options to support your child with mental health needs at school. And most of us as advocates at Pacer are parents of kids with disabilities. So that is the end of our presentation. However, we do have a question and answer time. And I'm going to turn it back over to Karen to take it from here. Thanks.
Thanks, Jeannie. Yeah, I'm looking. I answered one question that was in the question and answer box. Someone had a question about it's been difficult trying to find the best medication to work for their child. They did do the gene site testing. There's a test out there, the gene site test, it doesn't really tell you which medication to take, but it tells you which types of medications may work best or which ones might not work best. But this family is still struggling to figure out what will work best. I think the way I answered that, it would be best answered by your doctor. I'm not aware of any new tests beyond the gene site testing, but things are always evolving. And you may also want to reach out to different types of organizations, such as the Mayo Clinic or the University of Minnesota, or some of those types of places to see if there's new research or new tests out there. What's the holistic approach to anxiety, depression, or ADHD? So I think, when we talk about, holistic approaches, and it includes lots of things. I think, again, work with your provider, with your therapist, would include things outside of medications. So for example, I know my daughters did skill building through mindfulness activities, meditation, biofeedback, sometimes diet. So just looking at all different things that could help with those things. I don't know if that answers the question. Um, Jeannie, do you have anything else on that? As far as
I
holistic?
think she clarified down below
Oh,
for
okay.
medication. So I don't know if that
Oh,
means she's
okay.
looking for
Got it.
information about
Okay.
supplements
Okay.
or something like that. So,
So like a non-pharmaceutical medications, like supplements, things like that. Again, I would work, with either, a naturopath or sometimes, there's doctors who are not just MD, but they're a DO, and sometimes they have more experience with those things as well. At Pacer, we're not able to, um, give recommendations for specific medications or supplements, but just kind of help you navigate on who to talk to get that information. So again, checking in with a naturopath. Sometimes your pediatricians might have information about that as well. Um, yeah, and one other thing is sometimes support groups through disability specific organizations. So for example, for ADHD CHAD, they have local chapters and they, connecting with other parents and see what has worked for them. Is there any intensive support for medically complex and very behaviorally intensive children? We keep getting turned away due to not having medical staff to cover her needs, and behaviors are so intense and violent. We keep getting pushed along to the point no one can find resources to access. This is definitely an area where there is a gap. I know we get calls a lot, students who are trying to get into residential or day treatment programs and are being turned away because of behaviors. I wish I had an easy fix for this. Continue to work with your, if you're not set up with county case management, continue to work with them, work with your providers. Um, Sometimes possibly setting up if your child qualifies for a personal care attendant, sometimes having them on site with them to help, navigate some of the behaviors while the rest of the team is working on the skill building piece. Um, but it is definitely an area with a gap. Um, just took mental health first aid for youth day-long training from NAMI, which I highly recommend. It left me feeling pretty enraged that my 11-year-old school missed the signs and symptoms of his depression, suicidality, anxiety, and ADHD. How can I let the school know they let us down? Reach out to them. Reach out to the school. I would say, maybe a good person to talk to would be the social worker. Or if your school has a school-based mental health clinic within it, talk to them about that. You could also go to the district level, speak to the superintendent, um, speak to the SEEK, the Special Education Advisory Council. Reach out to whoever you can, and recommend that they do that mental health first aid training. I know to keep teaching licenses current, there has to be so many hours of training every year. Um, that does relate to mental health. I'm not sure exactly. I've been out of teaching for a while, so I don't know exactly how many hours are required, but definitely bring it up as a suggestion. School board too might be another place to, recommend that teachers take that training. I have a caseworker assigned from the county and she's great with ideas for services and referrals, but I need more help on implementation. I feel like I need a PCA for my homebound school, 13-year-old daughter. I need help with transportation as a single mom who works full time. Is there something my caseworker is supposed to help with? I still feel overwhelmed making a plan. Yep, continue working with your caseworker. We do have a few advocates here at Pacer who help navigate some of those systems as far as, the smarting process, they work with health information. So you could give us a call, let us know what your specific concerns are, and that'll, one of those advocates could help. I have an 11-year-old child who has EBD and last 2 days, threats of killing herself. I told her therapist and no reaction. I don't know what to do or who to go to. I'm sorry to hear that there was no reaction. You know your child best. If you feel that there's, immediate, risk of self-harm, you can call 911 or take her to an emergency room. Um, again, if you're not set up with county case management, it sounds like it might be, a good time to do that. Also, calling crisis, that 988 number or the county crisis, and they can help you navigate that as well. And even taking her into the pediatrician's office and they could do a threat assessment as well or refer you who to talk to. Um, my son does chiropractor once a week. Um, a DO doctor. I forgot what it stands for, but I know one of my daughter's psychiatrists was a DO. So they go to medical school like an MD, but they also learn about holistic approaches as well. So they kind of have some extra training in that area. Um, how do I initiate an IEP request at the start of kindergarten? My son is 5 and had to leave a private school due to behaviors. I want to set him up for success. I'm quite sure he will need services. Do I have to wait for them to see problems before requesting an assessment for an IEP? What is the process? Yeah, give us a call. We can help you navigate that. But no, you do not, need to wait. It sounds like there's some data already from preschool that he's been struggling and possibly needs some services. So I would suggest reaching out to the special education director of the district that he'll be going to kindergarten. Let that director know that you have an incoming student who has some needs and you want to make sure that he's on their radar. Sometimes they do like to do some see what his response is to interventions that they might have before doing an evaluation. But I agree with you, don't wait too long. Um, so again, give us a call. We have some templates for requesting IEPs and we can help you navigate through the process as well. But that special education director would be a good first place to touch base, and they usually work year round. If a family wants to work with a county caseworker, is calling Hennepin County front door is still the way to start. Yes, and front door is a great place to start. And if that process isn't working, the other thing you can do, so for example, I called Washburn Center for Children, and they also have case management. So sometimes you don't always have to call the county to get county services. You can call an organization such as Washburn or POR or, other organizations like that. And if they provide case management, sometimes they will help you get set up and then they will bill the county for it. So sometimes going to an organization directly who contracts with the county can sometimes be a little bit quicker. Do you have any plan recommendations when the child sits on multiple spectrums with behaviors? ASD, ADHD, FASD, GAD. Okay. I guess when you're asking about a plan, I'm not sure if you're referring to like IEP plan or safety plan, not sure. So I guess, like we talked a little bit, in the presentation about looking beyond the diagnosis and looking what the needs are. So sometimes, different diagnoses can have overlapping needs. So, and also reaching out to disability specific organizations. So for ASD, possibly Fraser or Autism Society of Minnesota, FASD, there's Proof Alliance. And again, give us a call. We can help you navigate some of those things. But I think looking at the needs and then Of course, it is important to know where those needs are coming from, because a student who has ASD, schools might address that need differently than a student who's under EBD. So, I agree with you. It is important to know where those needs are coming from, but I would focus on those needs. Thank you, Michelle, Doctor of Osteopath. That's what the DO stands for. I took my son last week to a behavioral mental health hospital urgent care. I don't know what else to do because he doesn't have the help he needs that's near us. Is there a way to start a group with, autism services? I guess, you could reach out to Minnesota Association of Children's Mental Health. You could reach out to some of those autism specific organizations and see, they often have support groups out there and sometimes would have information about starting your own group in your area. Safety plans with overlapping needs. How do you explain it to others? When you say others, are you talking about schools? Are you talking about community? I'm not sure. I guess explaining things to others, just stating, these are the needs that my child has. This is a safety plan. Yeah, so I'm guessing, I'm not sure which environment you're referring to, but definitely, with the schools can create safety plans. You can have a safety plan for you as a family in your house. I know when my daughter was engaging in more self-harm, we had a lockbox for knives and sharp objects. And so you can have different safety plans for different for different settings. And I guess as far as explaining it to others, just, let them know what the needs are, what the safety plan is, and how to implement it and why you have it. And, if it's, for example, a babysitter, let them know where that safety plan is, let them know the process. Yeah, I hope I answered your question. I'm not quite sure what setting you're referring to. So anything else? I think, oh, let's see. Our teen does not exhibit anxiety behaviors at school and typically performs above grade level. He was denied for a 504, and we are now working backwards after a mental health crisis. We had communicated triggers to individual teachers, and they acted completely contrary. Is an IEP a stronger tool to implement? So there's different layers of accountability with an IEP and a 504. A 504 plan falls under the Office of Civil Rights, and IEP falls under the Department of Education. There are more required check-ins with an IEP. You have that annual IEP meeting, you have goals, you have progress reports. So there is kind of that extra layer of accountability on the school with an IEP. That said, the student would need to meet criteria for the IEP. And again, give us a call and we can help you navigate through that for requesting an IEP. As also with 504, sometimes a school may say, so for example, you have a student with ADHD, let's say, and that student is on medication and doing fairly well. The school may say, well, they're doing really well, they don't need a 504 plan. There's something under the language in 504 called mitigating factors. And mitigating factors, for example, one of those factors would be medication. And what that mitigating factor means is the medication is a mitigating factor that improves the symptoms of the disability. That said, a school cannot deny a 504 plan based on mitigating factors. So if your child is doing well at school because they're on medication or whatever it may be, or have a mitigating factor, they can't use that as an excuse not to provide that 504 plan, if that makes sense. So the disability is still there and the needs are still there. So again, give us a call and we can help you navigate that through that as well. We notice autistic behaviors at home, but the school's evaluation does not see it. Any suggestions? You could have them, I'm not sure, oh, sorry. Um, so, you could have them look at, if they have not done an evaluation, have them ask for an evaluation. If they've done an evaluation but did not look at the ASD criteria, you could ask them to reopen the evaluation and look at that. Feel free to give us a call. We can send you a copy of the criteria for ASD on an evaluation. Again, if they're not noticing it at school, but you're noticing at home, I guess you could ask them some questions regarding some of the things you're seeing at home. And sometimes things are seen in different environments. Oftentimes we see kids, things are presenting themselves at school and not at home. So different environments have different stressors, different requirements, different stimulation level. So it really just depends. But give us a call, and again, we can help you, give you some talking points to talk through that with the school. But looking at that evaluation, like I said, if they did not look at it, I think that's all I see on here. Let's see here, and it's 1 o'clock. So Jamie, I think we're good.
Okay. All right. If that's it, we can end today's webinar. Again, that survey will pop up at the end. You'll see a link to a survey, and we hope you'll take that survey. And also, if you don't see the link, look for that follow-up email tomorrow about this time. And that link will be in that email as well. So
Great.
anything else, Karen, or?
No, I think that's it. Thanks everybody for joining us today. Have a good day.